Hello, good evening, everybody. Dr. Santa Ana, this is Dr. Nabidi. We're here from the Michigan Center for Regenerative Medicine, and this evening's topic is all about insurances.
Real riveting topic for tonight. Yeah. Something everyone loves talking about is their health insurance, what it covers, what it doesn't, how to utilize it to the best of your ability, but also our approach to not just sticking within that box that our your insurance company oftentimes confines us to, also offering services that maybe aren't recognized by your insurance yet, and then how we go about including them into our treatment plans.
Yeah. So you might find it funny, but learning about insurance is not something that we learn out of medical school. This is something that we stumble through as you become a physician, and out of training, you kind of learn what you can and can't do and what the rules are with insurance. And for the complicated things, each insurance has a different rule and subset of rules that you have to follow. So it gets a lot more complicated. So if you have a hard time understanding insurance, you're not alone.
No, you're not. Yeah. I summarize that by I might have, let's say, 5 patients with absolutely identical stories, absolutely identical problems, and I want to treat them all the same. I might have to treat all 5 of them differently based on what their insurance tells me I have to do first, second, and third.
Yeah.
So it's a very frustrating system for both the patients, for the providers, but that doesn't mean we just throw our hands up and don't try and don't do what we think is best for people.
Yeah, so we try and play within the rules of the insurances that they set forth. They're all made all in good light and good effort, but sometimes blanket rules don't work for individuals. So here at Michigan Center for Regenerative Medicine, one of the goals we wanted to do is to offer different treatment options that may or may not fall under the category of insurance. And even the ones that do fall under the category of insurances, that patients have the opportunity to avail of those opportunities if possible.
Yep. So a lot of our regenerative procedures, unfortunately, insurance is still classified as being experimental. And that clause in your insurance contract allows them to deny coverage for it. We do and can try to get prior authorizations, which is one of the terms that we want to cover tonight. Which is essentially us asking permission to do a procedure.
Right.
So when we see you as a patient, we do a nice evaluation. We come up with a great treatment plan. Before we implement that treatment plan, we have to send specific codes and paperwork. They might even ask for outside medical records to demonstrate why that medical decision is an appropriate one for what we want to do as your next step to help treat your medical problem.
Yeah. So let's say you do come to our office and you have severe back pain or severe knee pain, and you see me or Dr. Nabidi on that same day. And, if because we don't do your procedure or any treatments that same day, it's not because we're not compassionate, we don't like you. It's just because we have to get authorization from the insurance in order to have that procedure done so we can get reimbursed for the procedure. So some insurances allow us to do procedures the same day. Some insurances need a certain amount of time and that prior authorization to move forward, even for testing and even simple things like that. So, and each insurance's rules are a little bit different. But we've done this a few times that we kind of know some shortcuts and ways to make it more efficiently to do.
Yeah, a lot of it comes down to documentation, what you write down, how you write it down. Certain physicians in this practice are less good at documentation, but fortunately I have great staff that catch it when I miss specifics as they're going through that process of getting your prior authorization. Same staff that put together a wonderful handout that we want to make available to everybody with specific terms when you're describing things like prior authorizations, like getting referrals, what's an HMO, what's a PPO, what's the difference between the two, what's my co-insurance, what's my co-pay, what's my deductible. All those fun, fancy terms come into how much a procedure costs or how much your portion of that cost is going to come. And it just comes down to your specific policy, and everybody's policy for the most part is different.
Yeah. So I know I have some patients ask me, if I do this procedure, how much is it going to cost me? And I usually say I don't know, because it's true. Like, I really don't know, because it all depends on what your insurance carrier negotiated with our plan and our big group. And yeah, so everything's a little bit different. But kind of looking at that, you want to dive in different definitions, just kind of.
I think we spend a little bit of time because there's a lot of confusing terminology that can get thrown around, and it's helpful to understand that, when we're communicating and talking to know when we say something like, well, that went towards your deductible. So for example, let's say we're going to do a common procedure we do here is something called an epidural steroid injection. It's something that insurances recognize as being an appropriate medical procedure, given that you've done certain and had a certain set of circumstances of history and exam findings, and that you've tried various different things, usually some physical therapy, maybe some medication management. You've had some x-rays before we go in, and they allow us to do this epidural steroid injection. We can come up with whatever fee scheme. We can say it costs $1 billion, which is obviously ridiculous, but more appropriately, let's say we say it costs $500. But our physician health organization is you think of it like a negotiator for physicians like Dr. Stanton and myself
in the area,
for the area that will go out and negotiate with your insurance company for rates. And they might say, no, that pay according to our insurance is $350. Then we will discount that procedure. The 500 minus the 350 will discount at $150, and that's the negotiated discount. And you often sometimes see that on a piece of paper you get from your insurance called your explanation of benefits,
EOB.
When we're talking about, or when people are asking the question that Dr. Santana gets or referenced earlier, how much am I going to have to pay for this? The answer is it depends. It depends what that negotiated rate has been with your particular insurance company, our office, and we don't have direct say in that. That's not something either Dr. Santana or myself spend our time, fortunately, doing on a daily basis. We get to focus on seeing patients, treating patients, and coming up with treatment plans.
Yeah, and it's usually not a choice. It's either we take it or we don't, and that's really not a choice at all for us.
And that's for us to be what are called in-network providers, which is another one of the term. There's in-network providers and there's out-of-network providers. Now, if we decided we wanted to be an out-of-network provider, then those negotiated rates kind of go out the window, and we can take what that typical rate would be and then charge the difference should we feel that would be necessary. But I think both Dr. Santana and I agree. We want to make ourselves available as much as possible. People do have health insurance. They pay high premiums for those health insurance. And we like to utilize health insurance when it's possible. Same
here too. And then the rules are different too, depending on if you have a commercial plan, like a typical Blue Cross, United Healthcare, HAP, those types of providers, versus if you have a Medicare plan for somebody who's over 65 and has Medicare benefits. And under Medicare, there's different rules there too, where you can have supplementaries and secondaries that can kind of help with the costs. And then the third group is the Medicaid plan, which is a state plan for people that need the extra help. So with Medicare, the rules are a little bit easier. Thank God for the federal government. I mean, it's not, there's still some rules that we have to follow, but things are a little bit easier to take care of our elderly population, people who've kind of done the work and have retired at 65. They do deserve the best care. So we try and do our best and accommodate for those patients. The patients who are on the commercial plan who do work and then they get it through the marketplace or one of those providers, those ones, the rules are very different between them. Even just in a Blue Cross plan, there's different variations of that Blue Cross plan that can change. Your deductible and the negotiated rate and even the copays can be a little bit different. So deductibles are essentially what everyone is responsible to pay before the insurance will pick up that cost. So for example, typical deductibles for a family would be $1,000 or $2,000, kind of like your car insurance. The first $1,000 or $500 is on you, and anything above that, the insurance picks up. So it's going to be the same for that too with health insurance. And
when health insurance starts to pick it up, the term that they use is called co-insurance. They usually don't start paying 100%. So say you have a $1,000 deductible, you pay the first $1,000 100%, and then after that, the next dollar after $1,000, so the $1,001, they start picking up. Usually it's a percentage of it, 70, 80, sometimes 90%. But you still have a smaller percentage, 30, 20, 10% called coinsurance. And then that will continue, that you'll pay that coinsurance until you hit something called your out-of-pocket maximum. Mm-hmm. So at some point, that coinsurance will go to zero, and the insurance will start paying 100% of all the bills after you've hit your out-of-pocket maximum.
Yeah. So when every year, typically when we start looking at insurance plans for me and my family, those are the things that we look for is, if everyone is in pretty good health, that you mainly just see annual visits and routine visits, stuff like that. It's okay to get the cheaper premium where you pay in a monthly. That means that your deductible is higher, and you make sure that your health is maintained, so you're not going to use the benefits of the insurance. Or if you know that somebody in the family has a chronic illness that needs to be seen more regularly, then maybe you'd want to get a plan with a higher premium with a lower deductible, so your out-of-pocket costs will be a lot less in the long run.
And then there's these plans called health savings accounts, which tend to be the latter of the two that I think the former, I can't remember which one you said first, but the one that has the lower monthly premiums, but then the higher deductibles qualify for what is called HSAs, or health savings accounts, where you can then pay using some pre-tax dollars into a savings account, much like an IRA or a 529, where it will grow tax-free. And then you can use that money to pay for health expenditures that would otherwise have to come out of your pocket as part of your deductible.
Yep. And then the other syllables you hear of is FSA, Wisconsin. Mm-hmm. So that one stands for flexible spending account, which usually is sponsored by your employer. So they give you an X amount of dollars to spend on medical conditions, but unlike the HSA, which grows every year, this one usually expires after a year, and it's either you use it or you lose it.
And those two are important ones for us to mention, because the regenerative type procedures that we offer, very few insurances offer any kind of coverage for them, which means that even if you pay out of pocket, it doesn't count towards your deductible. But they are eligible to utilize these HSA and FSA accounts because they are experimental for medically necessary conditions, not things like cosmetic surgeries or for cosmetic purposes. They're for functional and medically necessary procedures.
Yeah. So here at MCRM, so what kind of insurances do we offer? So I want to say we offer a good varying degree, right? So we take Medicare plans here. We take most commercial insurances, and we have a whole list that we can send to everyone on this webinar, so you can kind of see.
I believe it's on our website as well.
Yep, it's on our website also.
We try to make sure that's up to date and accurate.
Yep.
If there's ever a question whether we accept your insurance or not, our staff are excellent at researching that, and because there are a lot of sub plans within every United Healthcare plan, for example, that there might be a few odd ones here and there that we don't. But if we don't accept your insurance, we do have out of pocket or out of network fee screens that are very reasonable. We've had some patients come back and tell us that our out of pocket fee screens are less than what they would have used their insurance to begin with. So to try to ease that burden, that burden of access to care, we do try to keep our fee screens as low as we can, at a reasonable rate, really helping people get a consult where we're not just going to stick within that box that your insurance company is mandating we do so. We're going to talk about options that may skip steps that they want us to skip. And if you choose to pay out of pocket, you don't have to follow their rules. Right. If you choose not to use your insurance, and asking the questions, transparency and cost of healthcare, I think is one of the huge problems we have with our healthcare system, is that there is not transparency. You can't just ask your doctor how much does something cost, and we say, well, it depends on your insurance. If you want to bill your insurance, how much that's going to cost you. rather than just giving you a number like you do with almost every other industry.
Right.
And when we actually take insurance out of it and take the cost that's associated, we can deliver quite cost-effective care that gets equal, if not better, outcomes than what your insurance is dictating that you do.
Yep. So you don't have to prolong and extend and just actually get to the root cause of the problem and solve it and fix it. So this is one of the things that we pride ourselves here in the office is that we try the office visits we bill through your insurances. So like the normal doctor visit would cost you. When you come and sit with either of us, we would talk to you about your diagnosis, different treatment options, and different testings that we could do, which are covered by your insurance, which are not covered by your insurance. And you can make that educated decision on which way you want to choose. If you choose to go through the insurance route, then we can go ahead and support that. If you want to go to the best treatment, whether that's either jumping the line or getting ahead with testing or a procedure, or even a non-covered procedure like regenerative medicine, like PRP or stem cells or something like that, then we have that option there for you.
So a question I get a lot, and this changes gears a little bit, so I hope we're okay in timing-wise as far as changing gears. We still have a little bit of time. If regenerative medicine works so well, why doesn't insurance cover it? And I think that's a big question.
Yeah.
And it's one we get a lot of. And unfortunately, the reason is multifold, and it's a tough one to answer in a real quick solution. But I think the best answer there is, well, they don't cover it yet, and there's no doubt in my mind that within our timeline of practicing medicine, we're going to see large volumes of insurances cover these procedures because they do work. And they are much less expensive than their surgical options,
and they're very safe to do. Right. So that's the biggest fear that the CMS and FDA are these procedures safe? And I think doing this long enough and so much data is out there already that these are very safe procedures. A lot of times safer than your more typical medical and pharmacological. There you go. Treatments that offer in traditional medicine.
Yeah. And so we got to prove it. I think the burden or the challenge has been thrown on physicians like ourselves to collect data and document what we're doing, collaborate with other like-minded physicians who have that same mindset, who are eager and able to offer these sorts of high-quality regenerative medicine procedures, and then track those outcomes. And I think we're happy to say we're part of that solution. We're working hard to do that. We're using a platform internally through our lab. GrayLedge Technologies has a platform that they've launched with all of their regenerative labs that they run with ours, and then we're also using another one that's broader on a national level that compares not just other GrayLedge centers like ourselves, but with any regenerative medicine clinic using any regenerative medicine device. And it's a very open source, open platform. Really looking for best practices, what works best. And in my opinion, it's really comes down to three different variables we got to track, and that's patient selection. Who are good candidates? It's how do we inject? Using guidance, being accurate with where your needle tip is, and then what techniques you're using to put your needle in specific structures. Both Dr. Stan and I have more of the biotensegrity approach, where we're really injecting an entire structure, like a joint as an entire structure rather than just as a specific deficit. And then thirdly, it's what you inject, counting your cells, quantifying what you're injecting. The analogy I like to use, it's like trying to study a drug and not reporting the dose that you're injecting. If you don't count your cells, and if you don't give some sort of a quantification to what you've injected in someone, that's to me akin to trying to study a drug and not knowing whether you injected 1 milligram or 100 milligrams. We know very well with drugs that there's a bell curve. Too little is not good, and too much can cause side effects. Is that the case with stem cells and regenerative medicine? Well, if we don't even look to see what dose we're injecting, we'll never know. And that's one of the things that's really holding back from insurance companies covering this is how do they know that you're getting a quality regenerative medicine procedure, that you're getting a high quality stem cell procedure.
Yeah. So it's nice that, I think when patients kind of hear about that, about, all the advances that we're trying to push forward to making this field more acceptable, and so they'll have more access for more people. But in the meantime, just arming people with this knowledge and this information that, hey, you're getting a treatment that's very safe, that's being done in a medically professional way, and that's also being studied and looked at, does give you that extra level of confidence that this is the right plan for you. So it's not just spending the money. You actually you're investing in your future. You're investing in your health is what regenerative medicine does. And so one of the things that I want to challenge any of our viewers who have businesses, or have access to their HR, or has access to, or you have a small business or a company, and you think that this is the right way to proceed. One of the things that we definitely want to talk about and explore is, how do we have your company use us for regenerative medicine treatments for musculoskeletal conditions, and bypassing all the rigors and red tape and algorithms of regular insurance timelines, and getting your employees and your workers straight to our clinic, being seen right away, being treated right away, the right way, and getting them back into the workforce faster than how their traditional machine of medicine wouldn't allow. So I think that's another avenue where us being a smaller clinic, being more versatile and very flexible in these types of things, that we're able to help you and your company with.
And we have data now. We can support those statements. That isn't just us postulating and going off of memory, but we actually have hard data that we've been tracking for over 2 years now that show that we can get people better, faster, and missing less work with a fraction of the cost of their surgical option for the disorder they're complaining of. Rotator cuff tear being, I think, an easy example that most people have heard of. Have an arthroscopic repair, the downtime that's associated with that, the missed work that's associated with that, and then the surgical expenses associated with that. We can cut all of those into fractions of what they currently are.
Yeah.
And I would think that any companies that are self-insured, that are watching their premiums that they're paying for their employees, their EOBs that they're paying for their employees, would be interested in having that conversation with us. And we're very open to having that conversation. We would love nothing more for insurances to cover and to offer regenerative medicine for their beneficiaries, and coming to clinics that do it the right way. We know that outcomes are great if you do it well. If you select patients properly, you inject properly, and you inject the right type of quality product, you're going to get a good outcome a large percentage of the time.
Yep.
So, we have a lot more terms. I don't know if that's the best use of time. If there's specific questions that anyone has, we would certainly open it up to the viewership. We like to keep these talks less than a half hour. We're kind of closing in on that time.
We're at a half hour.
Yeah.
Okay. So like I said, so Dr. Nabby said, so we are going to be sending this out to our viewers here in this webinar, and it's also available on our website. There's a lot more information on our website also, that not just the insurance side of it, but more clinical side of regenerative medicine, specific treatments that we've done for knees, shoulders, spines, every other joints that we've done. What's the difference between PRP and stem cells? We've looked at those as well. So we'd love you to go look around in our website. If you have any questions, please reach out to us or schedule an appointment for us to sit down with you, and we'd love to have that conversation.
Yeah. So thanks for tuning in. I appreciate it. I don't see any questions coming across.
Yeah, so I think we nailed it.
Yeah, we must have.
Yeah.
I appreciate everyone for tuning in. And if we can help, please give us a call. Michigan Center of Regenerative Medicine. We're in Rochester, Michigan, 248-216-1008.
Thank you.
Good
night.